You know that what you eat can change how your kidneys work. Recent research suggests that certain fruits can increase urinary citrate, reduce inflammation, and even act as mild diuretics, helping to lower the risk of crystal formation. In this video, you will learn 8 evidence-based fruits that support kidney health, how they work, how to eat them, and who should be cautious. There are 8 items, each with the science, practical serving ideas, and sensory notes so you can add them to your routine right away. For credibility, studies published in journals such as Nutrition Journal and Journal of Agricultural and Food Chemistry are referenced, and experts from nephrology and nutrition provide comments. Stay to the end for simple recipes and a clinical caution most people miss. Now, let us move to a short primer on how these fruits act inside your body and why small changes matter. The kidneys filter waste and balance minerals and acid base. Compounds like citrate bind calcium in urine, reducing crystals, while antioxidants and anti-inflammatory molecules lower kidney tissue stress. Some fruits provide vitamin C, which acts as an antioxidant but can increase oxalate in some people, so balance matters. Diuretic effects increase urine flow, helping flush small particles. A mix of observational and controlled trials show meaningful changes in urinary markers when certain fruits or juices are consumed regularly for weeks. Consult your doctor before making major changes, especially if you have proteinuria or advanced kidney disease. Now see the first fruit on the list and why it often sits on kitchen counters around the world. 1. Lemon. The bright yellow pulp and the sharp citrus scent are familiar and easy to use. Lemon is rich in citrate, which binds free calcium in urine and helps prevent crystal formation. A controlled trial reported an increase up to 50% in urinary citrate with daily lemon juice intake over several weeks in selected participants, according to a study published in Nutrition Journal. Taste-wise, the sour pop hits your tongue. The peel gives a floral citrus aroma, and the juice feels cool on the throat. How to use it? Squeeze half a lemon into a large glass of water each morning, or add slices to salads and fish. Specialist Dr. Maria Santos, nephrologist, explains, in a short exchange, Host, what makes lemon so helpful? Doctor, lemon provides citrate, which reduces stone-forming complexes, and the vitamin C adds antioxidant support. Host, so small changes like a glass daily make a difference. Doctor, exactly. Regular modest intake can shift urinary chemistry without excessive vitamin C. 2. Watermelon. The juicy red flesh is visually striking. The sweetness washes across your palate. The texture is crisp and watery, and the smell is faintly sweet. Watermelon is high in water content and contains lycopene, which acts as an antioxidant. Increased hydration paired with lycopene may reduce oxidative stress in renal tissue. A 2019 animal and small human study in Journal of Agricultural and Food Chemistry highlighted reductions in markers of kidney inflammation with lycopene-rich diets. Eat it chilled as cubes, blend into a hydrating smoothie, or pair with a pinch of salt to enhance electrolytes. Dietitian Dr. Aisha Rahman notes that watermelon is a gentle way to increase urine output without adding caffeine. 3. Blueberries. The deep indigo color, the burst of tart sweetness when bitten, the velvet skin, and the faint leafy aroma make blueberries appealing and easy to add. They are rich in antioxidants and anti-inflammatory polyphenols that can reduce low-grade inflammation linked to kidney stress. Observational studies associate regular blueberry intake with lower markers of systemic inflammation and improved metabolic health, and a small randomized trial showed favorable urinary oxidative markers after 4 weeks. Eat a handful daily on yogurt or porridge, blend into sauces, or freeze for snacks. Patient Samantha says, I started adding blueberries to my breakfast and felt less bloated after a week. Host, how long until you noticed changes, Samantha? Within 2 weeks, my urine felt clearer and I felt more energetic. 4. Pomegranate. The jewel-like arils are glossy, have a bright tang that balances sweet notes. The juice stains fingers and leaves a rich aroma. Pomegranate contains polyphenols that act as antioxidants and may reduce inflammation in kidney tissue. A study published in 2017 in a clinical nutrition journal reported antioxidant benefits in patients with early kidney dysfunction when pomegranate juice was included as part of the diet. Practical use. Eat arils raw, add to salads, or dilute the juice with water to cut sugar. Urologist Dr. Michael Chen recommends moderation because concentrated juice has sugar and can affect blood glucose. Pause for a moment and tell us in the comments which of these first 4 fruits you already use and what change you saw. If you already consume any of them, type I already use, followed by the fruit name. Or type I want to try and the fruit. Your short comment helps others understand what really fits daily life. If you have tips like quick recipes or preferences for organic versus conventional, mention that too. It helps the community. Sharing your result, even in one sentence, can guide people who are nervous to try something new. We read and highlight real stories in future episodes, so your contribution matters. Now returning to the list, here are fruits 5 through 8 and how to use them safely. 5. Kiwi. The bright green flesh, the tiny black seeds that pop when chewed, the tangy aroma, and the soft but slightly fibrous texture deliver vitamin C and act as a mild alkalinizer. Kiwi supplies vitamin C, which is an antioxidant, and also contains fibers that can modify gut mineral absorption. A randomized dietary study showed improved urinary pH and reduced markers linked to crystal formation when participants increased citrus and kiwi-like fruits for several weeks. Eat 1 kiwi daily or blend into morning smoothies with low-fat yogurt. Nutrition researcher Dr. James Lee points out that kiwi is a good swap for sugary snacks and adds that those on blood thinners should check with their physician. 6. Pineapple. The tropical scent, the fibrous sweet flesh that tastes of sweet acid, the juicy release, and the bright golden color are unmistakable. Pineapple contains bromelain, an enzyme with anti-inflammatory properties which in some studies reduced markers of inflammation systemically. Bromelain may support recovery after inflammation tied to urinary tract irritation. Consume fresh pieces, grill slices for salads, or blend into a salsa. Patient Carlos reports, I added pineapple after a kidney stone event and felt less soreness. Host, how soon, Carlos? Within days, my discomfort eased and my urine seemed less cloudy. 7. Apples. The crisp snap when you bite, the faint floral skin scent, the slightly tart sweetness, and the clean finish make apples a versatile choice. Apples contain polyphenols and pectin fiber that may reduce inflammation and help manage blood sugar, which indirectly supports kidney health. Large population studies show habitual apple consumption correlates with lower risk of chronic kidney disease progression, though causality is complex. Eat an apple with a handful of nuts as a convenient snack or grate into oatmeal. Renal physiologist Prof. Elena Garcia emphasizes whole fruit over juice to keep fiber and reduce sugar spikes. 8. Cranberries. The tart bite that puckers the tongue, the glossy red color, the astringent texture, and the sharp aroma are distinct. Cranberries contain proanthocyanidins, which may reduce bacterial adhesion in the urinary tract and act as antioxidants. Studies show cranberry products can reduce recurrent urinary tract infection risk in some groups and may modestly benefit urinary markers tied to kidney health. Prefer low-sugar versions and consult if you take warfarin because interactions are possible. Now a quick evidence and safety summary. Across trials and observational studies, some fruits such as lemon and citrus increase urinary citrate by notable percentages, with trials reporting increases up to 50% in selected cohorts. Antioxidant-rich fruits like blueberries and pomegranate lower inflammatory markers in several small studies. However, many studies are short-term or small in size, and results can vary based on baseline health. People with advanced kidney disease, those with high potassium levels or on potassium-sparing medications, and those with proteinuria should consult a nephrologist before increasing high potassium fruits. Those with oxalate stone history should moderate high oxalate foods and discuss options with a clinician. Remember, moderation and context matter, and food-based strategies complement medical care, not replace it. Practical tips and quick recipes to put this into action right now include 3 to 4 ideas. First, make a morning citrate water by squeezing half a lemon into warm water, add a few mint leaves, and a thin slice of kiwi for flavor. Second, prepare a hydrating watermelon and cucumber smoothie with a scoop of plain yogurt and a handful of blueberries to balance sweetness. Third, create a fruit bowl with apple slices, pomegranate arils, and a sprinkle of toasted seeds for crunchy texture and extra minerals. Fourth, keep portions reasonable. Aim for 2 to 3 servings of these fruits per day, distributed across meals to avoid sugar spikes. For alternatives, if you cannot tolerate certain fruits, try vegetables with similar compounds such as cucumbers or herbs, and always prioritize whole fruit over concentrated sweetened juices. To close, in short, these 8 fruits offer citrate, antioxidants, anti-inflammatory compounds, and hydrating benefits that can support kidney health when used in moderation and alongside medical advice. Start today by choosing one simple swap, like lemon water in the morning or a daily handful of blueberries, and observe how you feel over 2 to 4 weeks. If you have kidney disease, proteinuria, are on medication affecting electrolytes, or have a history of oxalate stones, consult your doctor before making changes. Did any of these fruits surprise you? Which one will you try first? Share in the comments with "I will try" followed by the fruit name and your time frame. If you found this useful, subscribe for more evidence-based food lists and practical recipes from experts, including Dr. Maria Santos, Dr. James Lee, Dr. Aisha Rahman, Prof. Elena Garcia, and Dr. Michael Chen. Remember, small, consistent choices add up. Your kidneys work for you every day. Choose to help them return the favor.